Welcome, everyone. Thank you so much for joining us for this exciting launch of the COVID Circle Learning Report, hosted by GloPID-R and UKCDR. As you'll have seen, this is a Blue Jeans live event. You'll only be able to ask questions through the question and answer function. That's located at the top right of your screen. Once questions are posted, you can upvote the questions by pressing the like button, and then we'll be able to ask the presenters and the panelists those questions which are liked the most. Please, when you do want to ask a question, if you do, please include your name and organisation so we know who it's coming from. And you can also highlight who it's addressed to so that we can get the most out of the discussion today. This event is being recorded and it will be added to both the UKCDR and GloPID-R websites for those of you who couldn't join live. Really pleased to welcome you all. We've got a really exciting agenda, including presentations, a panel discussion with funders, and opportunities for you to ask those questions we've just been discussing. So to kick us off, I will hand over to Mary Staunton, who's the chair of the SCOR board in the UK, who will provide some opening remarks for us today. Over to you, Mary.
Thank you, Alice. And welcome everybody to the COVID Circle dialogue between funders and researchers, and to the challenge you're being invited to tackle today: do better in epidemics and pandemics. Today, the WHO is reporting 4,999,000 deaths related to COVID. And today's report, the COVID Circle Lessons for Funders, warns of the consequences in lives not saved of wasting precious time on duplicating research on COVID. I am, as Alice said, Marie Staunton. I'm the independent chair of the rather clumsily entitled Board for Strategic Coherence on ODA-funded Research. It brings together the chief scientific officers and the directors of the main UK funders of research for development, and we oversee UKCDR's work in tracking research for development. Our mission is coherence, and lack of coherence is dangerous in a public health emergency. When COVID hit, we knew that funders had a long-standing problem: the danger of duplication. Different funders funding multiple to often small-scale clinical trials, studying the same questions and therefore wasting time and wasting precious resources. We launched the COVID funding tracker in collaboration with GloPID-R. Emergencies can catapult new ways of working, and the COVID-19 Research Coordination and Learning Initiative, the COVID Circle as it's called, is an example of this. It was fast and it was effective because it was based on a pre-existing partnership, and those are the partnerships that are most easily activated in emergencies. And the COVID tracker leveraged our complementary skills, UKCDR's capacity and its data skills to develop the tracker, and GloPID-R's disciplinary expertise, its reach, its network of global funders. The tracker has been a key tool for funders. It showed gaps, for example, in the study of long COVID, in lack of studies in lower middle income countries. We held conferences so researchers and funders could share findings, could learn together. And our work showed how much lower middle income countries had been overlooked, whereas they should be a top priority. And it uses 7 funders' principles to help funders to coordinate an effective research effort. And from the case studies published with today's report, you could see that COVID lessons had already been learnt from Ebola. Funders were agreeing projects in weeks, not in months. They overcame many, but not all, obstacles to data sharing. And it allowed timely, practical research to produce guidance on protection of children, which went to hundreds of thousands of people. So it can be done. And your task today, with the help of the expert panel, is to work through how we can be better going forward. So in this pandemic and in the next epidemic and pandemics, Precious resources are not wasted. They're used effectively to save lives, to save livelihoods. Back to Alice now for lessons learned.
Thank you very much, Marie, for those really engaging thoughts and for setting the scene for today's meeting so well. Now, myself and my colleagues who've been working on this initiative ever since July 2020 will now introduce the key messages that have emerged from our work in the report published today. So I'll hand over to Rachel to kick off this presentation.
Good afternoon, everyone, and thank you, Alice. So I will just quickly run you through the background of COVID Circle and how we've got to where we are today. So many of you may already be familiar with this image, and as Alice just mentioned, COVID Circle started in July 2020 as a joint initiative between GloPID-R and UKCDR. The core activities of Circle can be broken down into the 4 elements shown here. So firstly, we have the principles and priorities. We established 7 funder principles which were endorsed by GloPID-R and UKCDR members and were formally launched in The Lancet in July 2020. The principles underpin all of our work, and they also form a framework which the learning report has been built upon that's published today. Secondly, the mapping and analysis activities that we partake in are crucial to the work. This includes the COVID-19 Research Project Tracker and the associated quarterly analyses, which my colleague Adrian will speak to shortly. And in the third element, we have built an online community of COVID-19 researchers and provide a platform for mutual learning and connection. So these different elements have all fed into the learning element, which we are here to discuss today. Next slide, please. So as mentioned earlier, the 7 funder principles, which are highlighted here on screen, have formed the foundation of COVID Circle's work and provide a framework for the report and the associated outputs. This report published today really aims to provide guidance for how funders can achieve these principles. And the report was established through various funder and researcher surveys, data analyses, and broad stakeholder consultations. You can see that we've produced a variety of outputs, all of which are available on UKCDR's website. And these also include annexes to the main report. The annexes are very detailed and they include all of the surveys and the full write-ups of all the consultations we did. So there's really rich information there as well. Now I will pass to my colleague Adrian, who will highlight the key findings of the vertical analysis.
Thank you very much, Rachel, and good day, everybody. So at the heart of our data work for COVID Circle is our research project tracker, which we launched in April last year and presently contains data on more than 13,000 research projects worth at least $5.2 billion. These projects, which are not limited to the medical sciences, are additionally coded against the WHO research roadmap that was published in March 2020. To make this data a bit more digestible, we produce a quarterly analysis of the tracker database, which makes use of a variety of summer statistics. However, as part of this learning report, we performed what we call a vertical analysis, whereby we use the data from the April 2021 version of our tracker, so that's a year's worth of data, to produce some additional analyses that we don't normally perform as part of our quarterly review. We did this to understand how the research response to the pandemic has evolved over the first year, particularly as it relates to low and middle income countries, and what learnings can be derived from this. I'll only be presenting a small number of findings from the analysis today, but please do have a look at the report and its annexes to explore our findings in more detail. Next slide, please. So this chart plots the cumulative number of projects and funding amounts for 2 sets of data, namely projects which we've referred to as LMIC focus, which we define as research projects taking place in at least one low and middle income country. And the other data set that's included here is all the other projects, which we've simply labeled as rest of database. These cumulative totals here are plotted against the data funders' published award information if this was made available. So generally speaking, while both sets of the data that we have obtained see their largest increases in the number of projects over the summer of 2020, the increase in the number of LMIC-focused data was at its greatest in August 2020, 2 months after the peak increase for the rest of the database. And while it might be difficult to see due to the scaling, the chart also shows that proportionately more attention has been placed on LMIC-focused research in the second half of this time period, according to the data that we have. Next slide, please. So using the data that we were able to obtain for our analysis, we found that 102 funders funded COVID-19 research taking place in at least one LMIC. So as a way for us to understand the international research response to the challenges facing low and middle income countries, this chart shows the cumulative number of projects awarded by funders based in high income countries. So here we've only included funders that awarded at least 10 research projects in our database. There are a couple of interesting findings here. Firstly, that Canadian research funders were the first in our database to fund COVID-19 research focusing on LMICs early on in the pandemic. And secondly, only 4 of the 16 funders on this chart have demonstrated an active and significant commitment to funding LMIC-focused research, having awarded projects in at least 5 different months. Next slide, please. So, though there were almost 4,000 institutions that were listed as the lead organization on the projects included in our database, this map shows the location of lead institutions for the LMIC-focused portion of our data. So overall, we found 910 institutions were designated as lead to carry out LMIC-focused research. And at the national level, the greatest number of these institutions were based in India, Brazil, and Mexico. Looking at the bar chart on the left-hand side here, we've listed the institutions leading on the greatest number of these projects in our database, with institutions based in Brazil being the most prominent, as we can see here, 7 being listed in the top 10. However, the data we have also showed us that only about a quarter of the 200-odd institutions based in high-income countries that led on LMIC-focused research did so on more than one of these types of projects. So this suggests that there's a strong concentration of institutions leading on this kind of research. I'll now hand over back to Alice to speak about some of the lessons learned.
Thank you very much, Adrian. So as Adrian's just presented some of the high-level findings from vertical analysis, and as Rachel outlined, we also had input into this work from research consultations and funder consultations, which are all detailed in the report itself. So we now move on here just to really highlight to you now the key lessons learned that came from all this work and are detailed in the report. So to start with, it was very clear that the global research response to COVID-19 within the first year of the pandemic was unprecedented. The global distribution of funding initially was really quite focused on high-income research and has started to shift, although is still a very low percentage of that research taking place within lower middle-income countries. Funders and researchers really appreciated the early development of the COVID-19 research priority roadmap by the WHO Blueprint team and GloPID-R, although in terms of aligning, which is one of the principles, to more regionally developed and local research priorities, that was hindered by either delayed or lack of availability or visibility of such research priorities. And that's a key lesson that came out of this work. Multiple barriers exist and continue to exist to funding research rapidly, which is clearly what is very necessary within such situations. And it was clear from the work that this was particularly exacerbated when that research funding was going to low and middle income partners. And therefore, this is an area that needs much more attention. As with across the board, research funding was most easily facilitated and research was most easily activated through pre-positioned partnership, and where some element of funding was already flowing to those partnerships. One of the particular principles that really came out, the need for greater support, was around that for open science, which clearly within the pandemic has made huge strides, but still needs greater support in terms of data practice guidelines and harmonisation in that area. And it's clear from the presentation that Adrian just gave and the broader work of COVID Circle that the greater of global funder collaboration needed to ensure that high quality multi-country studies be funded to rapidly address research needs during pandemics. Next slide, please. So beyond those broad findings from the report also contains specific recommendations for research funders, both the UKCDR group of research funders and the global GloPID-R group of research funders. We won't have time to go into all of these, although I will run through them now briefly, but I point you towards the report for the detail there. These recommendations we have put against each of those 7 principles or potential areas for future work for funders to help them enable them to fulfill those principles in the way in which they fund and the research that they fund is undertaken in epidemics and pandemics for the future. So I'll pull out a few of interest here now. The need for support to strengthen local research networks involving local funders and researchers in advance of future pandemics came out, and the need for greater agile mechanisms for dedicated funding lower middle income countries. And you'll see in the case studies later some best practice examples that have emerged of that, but the need for greater work in this area. Research capacity for rapid research also came out with some really important recommendations for funders from this work. And again here, the idea for needing to have sustainable funding going to networks between epidemics and pandemics that can then be pivoted when a new outbreak emerges came through as key, and how funders can override and fasten their funding processes in emergency situations. Next slide, please. As I've already mentioned, open science and data sharing has definitely progressed and transformed during COVID-19, but recognition in this work that there is still a long way to go there, the need for consistent data sharing guidelines and for the GloPID-R data sharing roadmap to be translated from the policy really to the reality of the practicality to ensure that there's more cohesion in this area, and the need to set up platforms and agreements in advance came through very clearly. The next slide, please. Then moving on, again, I will just highlight on this slide around the principle of collaboration and learning through enhanced coordination, various recommendations coming through this for funders around how they can leverage existing partnerships by sustainably funding these into epidemic periods, and how funders can collaborate greater through existing networks. You will see some examples of best practice in the case studies later relating to this, given in terms of GECKO call, the R2HC call, and the EDCTP call, which funders can learn from in terms of how to coordinate rapidly in the future. Next slide, please. So we want to, at this point, thank all of you, many of whom I know on this call, who have inputted into this work, which has led to this report. It reflects inputs from the funder community and from the researcher community. We're very much looking forward to continuing this work with you in 2022, and with thanks for the funders of UKCDR and GloPID-R for this work. At this point, we now move to a very exciting panel discussion where we have some of the key funders who've been involved in this work joining us to discuss some of the themes that have emerged from this work, also importantly to take questions from you, the audience. So I would like to welcome the following panelists to start sharing your screens and join me up here. That's Dr. Josie Golding from the Wellcome Trust, Dr. Jean-Marie Haberguera from EDCTP, Dr. Joe Mulligan from the UK from Commonwealth Development Office, and Professor Charles Basongi from the South African MRC. And Nicole, if you could stop sharing the presentation, that's great. So now we can see you all on screen. I've obviously given you their names and you know where these panelists are from, but I would now like each of the panelists just take the time to individually introduce yourself before we get into the meat of the discussion. So, Josie, would you go first?
Sure, thank you, Alice. So I'm Josie Golding. I'm based at the Wellcome Trust, and I work on epidemics as the epidemics research lead.
And Jean-Marie, would you go next, please?
Yes, thank you. Good afternoon, everyone. I am Jean-Marie Viana-Barugira. I'm a senior product officer at EDSTP. Since a few years ago, in charge of the emerging disease, infectious disease, but also mainly lately the response to COVID-19.
Thank you, Jean-Marie. That's been keeping you busy. Jo, could we go to you next?
Hello, everyone. Real pleasure to be here. My name's Jo Mulligan. I'm the Senior Health Advisor and Head of the Health Research Team in the Foreign, Commonwealth and Development Office. We manage investments across the portfolio, actually, so across epidemics and global health security, but also infectious diseases, women and children's health, health systems, and humanitarian. And yeah, it's really, really exciting to be here. Thank you.
Thank you very much, Jo, for joining us. And Charles, would you please introduce yourself as the final panelist?
Yeah, thank you so much. I'm glad to be here. So I'm Charles Shea Wisonge. I work for the South African Medical Research Council, which is a funder based in South Africa, and we also conduct research. I am the director of Coherence South Africa, which is a unit at the South African Medical Research Council, and also a co-chair of GloPID-R. Thank you.
Thanks. So many hats you're wearing today, Charles, with us. That's great. So delighted to welcome you all panelists. To kick us off, I'll start with a simple question before they get more complicated. So I would like to hear from all of you, from your different hats that you've just described to the audience. What, in your opinion, is the most valuable lesson that funders can take from the COVID Circle Learning Report that we are launching today? So I'll mix up the order a little bit. Jean-Marie, can we go to you first for this, please?
Okay, thank you. Actually, the lessons are a lot, and it's not just lessons learned after the release of the report. It is from the start, from the beginning, the work that COVID Circle has been doing since April, May 2020, as we all were launching those calls. Actually, it was maybe one of the few corners where we could go and see evidence coming from ongoing research, and use evidence maybe to tailor the response ourselves. Because if we launched the call early in 2020, we were still signing those projects that were shortlisted as fundable, and because evidence was coming quickly from research going on around the globe, and COVID Circle has helped us in looking at what is really still the relevant proposal, because not whatever proposal was shortlisted in May 2020 was still relevant in October 2020, for example. So this report is actually an additional tool that we've been using to see to answer the question: are we still funding the right proposal? So it is also maybe one instrument which we can use to see if we can tick all the good boxes, that in terms of ethics, in terms of equity, in terms of strategic partnerships, in terms of using the capacity that we had built before the pandemic. So based on those 7 principles covered in the report, one can measure the relevance of the work which was funded, because we received a lot of proposals from the beginning, but also we allowed other projects to make amendments, those funded before COVID, and by allowing them to make amendments and taking new research questions addressing COVID, we did rely on those 7 principles to see if the amendments being proposed are really relevant, are going to make a difference. So this report, the 7 principles, they are relevant to us, to EDSTP, since day one, basically.
Thanks, Jean-Marie. That's really helpful, and great to hear that the principles have been an ongoing sort of guidance in your work going forwards. The report today kind of brings together a lot of the discussions on that. Jo, can I pass on to you with, again, your initial thoughts on kind of key take-homes from the report today?
Yeah, I mean, I think For me, there were two things I take from the report, and it was really, I really found it's always reassuring when when you see stuff that kind of confirms your own experience. And I think for us, the first was really the early actions of the WHO in highlighting the research priorities, and it's really good to see that as one of the key lessons. The fact that the prompt triggering of the R&D blueprint, which FCDO along with others has supported for a number of years. I think that was really vital at the beginning in kind of articulating what those research priorities were. And I think making sure that we're able to, that funders and researchers can closely align their activities with, with where the greatest research need was. And that research and those priorities really came by consensus. So, those of us that were there in those meetings in February, March, when we all didn't know where it was going to go, but it was really good, that kind of coming together of all the researchers. And I think, the important lesson that I have is that WHO has that convening power like no other organisation, and they were really able to make the best use of that. And for us in FCDO, those roadmaps and the work that they did also with GloPID-R, that was really helpful for us as a sense check to make sure that our initial focus was on track or in line with global priorities. I think the second lesson, if I can, it was a second lesson, and again, it's good to see it sort of reinforced in the report, is how the funding was best facilitated through those existing research activities, those existing partnerships, and actually, frankly, existing relationships. And I think it really, that was very much our experience in FCDO, and I think it emphasises the importance of supporting flexible, agile platforms and partnerships which can pivot quickly in an emergency. And I think that's something that we have really learned from, and I think we will build on. So those are my two take-home messages that I got from the report. Thanks.
Thanks, Joe, very much. Moving on quickly to Charles for the same starter question, please, Charles.
Yeah, thank you so much, Alice. I think what stands out for me, and of course, this is a very great report, is that funder relationships and partnerships that were built during peacetime, as it were easily activated during this pandemic, during the emergency. So what I take from there is that it is important, as recommended in the report, to have support for the development and strengthening of research networks involving local funders in advance of future epidemics, which hopefully will facilitate leadership for regional and local research priority setting. But it's a great report. There are so many lessons there, but this stands out.
Yeah, and just to say, the panelists have had a chance to read the report since its launch today, so prior to its launch today, so we're not putting too much on the spot here. Josie, could you please give us your initial reactions to the report and what you take away from it?
So I'm just going to re-emphasize something that Joe had mentioned about preparedness investments. And I think it's gone even further now during COVID, what we've seen. So yes, those who had preparedness investments were able to pivot towards COVID, but I would also stress, some of those actors were also actively engaged in responding to the DRC Ebola outbreak. So this was just an activity, they were continuing their work. I think as a funder, particularly because of the scale of this response, something that I don't feel we were adequately prepared was for more the impact on COVID to our whole research community, and how many were able to repivot their research focus to support the response. And I think that's just something we really need to be more mindful of going forward, and to really build on that the research investments really are very broad and wide-reaching. And so how do we think about that as we go forward? And then for any new actors into this space, there's many new funders. So trying to make sure we advocate the use for not just responding and funding in an outbreak, in an epidemic, in a pandemic, but to think about the utility of these investments going forward in daily use, so that they can be repivoted during an emergency.
Thank you all, and thank you, Josie. I think that's a really useful comment about the kind of the researcher community who have moved into this area, and the funder community started funding in this area for the first time as a result of COVID. And hopefully this report will help those funders who are newer to this area of funding in epidemics response. Now, I want to move the conversation on. One of the themes we wanted to explore with you as a panel is this sort of potential tension in funding speed, the quality of the research being funded, and access to that funding. And Adrian's given the figures of how rapidly funds is funded, but clearly funders want to also be funding the research that will be effective. So I've got a few specific questions there to kick off this discussion. Firstly, to Charles, want to come to you to give us your views on whether in any way rapid research funding comes at the expense of quality, in your view.
No, in my view, I don't think so, because it's good about, like what has been shown, that the rapid funding was more easily facilitated when there was existing funded research activities which were harnessed then during this. So what is important is that rapidity in an epidemic or a pandemic is very important. We need to fund research very rapidly. And for that, we need to have principles. The 7 principles were very useful, and having guidance, operational guidance on how to implement those. So definitely rapidity does not come at the expense of quality if there are principles and they are abided to.
Okay, thank you, Charles, very much for that view. And then Joe, I want to come to you to sort of get an appreciation, and we've got a separate question in that feeds into this around, do you think we responded quickly enough? One of the questions that has come into from the audience that I'll add on here is, as individual funders, how quickly do you think you did respond in terms of funding existing researchers versus new researchers in the pandemic? Joe, over to you first, if that's okay.
Gosh, I'll have a go. Yeah, I mean, I think, did we respond quickly enough? I think it very much depends on which aspects of the research you're talking about. I think in some aspects, I think we were able to sort of get out the traps fairly quickly. With Welcome, we launched a special call in February, I think, right from, so really early on into, a responsive, mechanism where we were sort of reaching out to known researchers working in the area, working in specific fields to try and get research launched as quickly as possible through our sort of established networks. We also launched a special window on humanitarian health through the R2HC program led by ELRA. So those are some of the sort of very quick sort of rapid response mechanisms, but again, very much working with existing researcher networks. And I think that is, that's probably the tension actually in terms of how quickly you want to be able to respond. I mean, if you're going to look broadly, sort of at a macro level, we saw unprecedented rapid progress in terms of vaccine development. And I think that, and again, that builds upon existing sort of pre-existing research that was going on for many years actually, but it shows that with concerted action that new solutions can be generated very quickly, and the UK was involved right at the start of that, both in terms of funding but also in terms of research, and we know there's some great success stories on the vaccine side. I think we were less fast on other aspects, I think, in terms of some of the gaps, and I think I can pick out a few, I'm sure others can pick out others that, we didn't make as much progress as we would have liked on therapeutics that were especially suitable for lower income settings. I think that took a lot longer than any of us had expected. I think what's good about the report is it highlights some of the other research gaps that remain in low and middle income countries, including health systems research, PPE, healthcare worker support and community engagement. Those are all areas where we didn't get the research funded as quickly as we would like. And I think I would add other gaps on behaviour science, especially for the most marginalised groups, and how we can make sure, that how we maximise equitable use of new interventions. So I think there were gaps. I think where we were able to move quickly on some areas where we had those pre-existing networks and relationships. Others, I think we were slower.
Thanks, Joe. Very comprehensive response. Before I move on, just to focus again on that audience question, would any of the other panelists like to give any comment on the rapidity of their funding to pre-existing researchers versus new researchers? Any of you want to give a view on that before I move away from that topic and carry on?
Yeah, maybe.
Oh, sorry, Jean-Marie, you go, Jean-Marie. It's okay.
Go ahead. Well, maybe Jean-Marie, if I can hear from you, one thing I wanted to ask you was is that link between the rapid funding and the announcements of the funding and the funding actually flowing to the researchers. And so maybe you can build that into your response. That's not setting too much of a challenge.
Yeah, I'll just make it short, but I'm just making a link between the existing mechanisms that we had and what I was going to call the new mechanism which responded to COVID. So we did have projects that were there, and those projects had funds to already start research. And in the early days, in maybe February 2020, a lot of lab skills strengthening work, a lot of early epidemiology work when first cases were getting into countries in sub-Saharan Africa. That kind of research was done using funding that was already given to projects before the pandemic. But then to answer your question, we had another mechanism, emergency mechanism, which had to wait for the declaration of COVID as a public health emergency of international concern. And from the moment that was declared, I think we did okay in terms of launching a call quickly after that. In practice, getting funds to the researchers, that depended on what I saw. Someone was posting a question about risk-based approach. This specific call had a mechanism where we give the researchers the possibility to ask for a fixed starting date of the project, but then the researcher takes a risk because if we end up not signing that grant, it is your own financial risk as an institution, but also on our side, it is a risk that we say, okay, we give you a green light to start your project before we finish the contracting process, but then we run into that risk of having to close the projects prematurely if they end up not being relevant, or if contracting parties end up leaving the process. So we managed to launch that call quickly, but the most important that we as funder had to give a compliment to ourselves, that someone somewhere earlier than the pandemic had thought that we need to invest in epidemic preparedness. And this is maybe the key, whether we are responding to COVID or future epidemics, for funders to have this kind of ongoing process that look into preparedness work.
Thank you, Jean-Marie. That's really helpful to hear that experience from EGCDP's point of view. Josie, moving on from that and thinking about, the report is about learning and learning from this experience of COVID. So in terms of this rapid funding, in your view, what are you looking to for going forwards? What mechanisms are already in place? What mechanisms are needed for both funders and researchers to react quickly in the future to epidemics?
So for some of the preparedness investments that we've made with SCDO, with Gates and others, we have built in that rapid responsibility, so being able to draw down on funds quickly in that, so that's the immediate decision. It's up to the researchers to make that decision on whether they support a particular outbreak. We have, over the years, particularly with the DRC Ebola outbreak, thought through our processes, because once you make a decision to fund a group, there is a whole process after that managed around, the financials of a company, of a research institution, etc., and due diligence that funders have to follow through. So that risk-based approach, trying to understand, okay, if it's for this sum, maybe then we approach the risk assessment differently if it's for a larger sum. And we did try during COVID to have some workarounds where we had never worked with a particular organization. How do we then, can we give funding to another organization who will be able to work with them collaboratively and disperse the funds? So there were ways to try and mitigate that. But ultimately, you can see that the greatest ease is those that we've already funded. And that, kind of puts all the emphasis on those small subsets of researchers globally, and that can be a lot to take on and really hard to deliver on. So I think we have to be very mindful going forward as we think about epidemic preparedness, how else and who else we should be funding, so that it's not just such a heavy burden on such a small subset of people.
Thanks, Josie. I think that's a really important reflection going forwards. I think we want to move on, unless any of the other panelists want to focus any more on that rapidity of research. We want to move on to this idea of priority setting. again, comes under the principles. It's one of the first principles is around research funders aligning to both globally agreed priorities, but also really importantly, locally agreed and locally relevant priorities for research in epidemics and pandemics. So this is an area we want to explore now with EU funders in terms of understanding what steps you took to align to research priorities. Firstly, starting with the WHO roadmap, and any the flexibility to adapt your funding calls as new priorities emerged, and as it was clear that potentially the research priorities in low and middle income countries might be different to in high income countries. And may I direct that to start with to Jean-Marie to explore your thoughts in that area?
Yeah, first of all, to repeat as well as that that list from the WHO roadmap was very helpful for us at the DTP, because we then had actually a homework to sit on in a few nights, maybe as a secretariat, to kind of propose a version of the list, which is maybe could go to our advisory bodies, and then they could sit on it, and have in mind the not very large budget we had for the emergency mechanism to advise on the few topics that we could focus on. And then this way we realized that we have just also to look at what it means, what those questions mean for LMICs for sub-Saharan African countries where we had to invest that money. Some of the things which we normally face also in other diseases, issues related to capacity to do epidemiology work in very different settings, whether you're talking about urban versus rural areas in Africa, or countries that have a research tradition like South Africa versus a country which has a lot of infection outbreaks over the year, but without a lot of research infrastructure, for example, DRC. So we had to put our heads together, basically having in mind that small budget we had, but the list was helpful. So in the end, we had maybe 4 research topics that we thought, okay, this is the focus. To focus on disease mechanism, epidemiology, validation of rapid tests if they were available at the time, and of course that was also a risk-taking approach, because some of the diagnostic strategies that were there in the early days, whether they were from academia or from industry, it was never sure whether they were going to make it, but there was a need for an organization like EDSTP to invest in those kind of tools if we're looking at increasing the diagnostic capacity in LMIC in Sub-Saharan Africa. So the call was really first taken from that long list from WHO, but in the end, looking at the countries in which we're going to invest in Sub-Saharan Africa. So it was a very helpful list. And in terms of flexibility, I think our flexibility was then looking at the prior investments. We have a lot of projects looking at HIV, TB, malaria, other NIDs. So by giving them the little room to amend the proposals, to take on new COVID-19 research questions, that was a flexibility that, at least in my experience with this, we never had to use before, because it was always, if a call was looking at malaria, let that man be used for malaria, but only now because the problem was so big, but also the research questions were many, and new emerging evidence were obliging us to rethink our flexibility, if I can say so. So we gave all these consortia the possibility to amend the projects. If someone had been awarded a fellowship, a training fellowship doing TB work, only in 2020, that fellow doing TB work was given that room to amend the training work and include a COVID-19 related research question. So that is, it has actually given us even the possibility to support COVID-19 research work at a scale which maybe we never imagined when we had in mind just the emergency mechanism.
Thank you, Jean-Marie. So there's definitely some really good examples of funder flexibility there from EGCT. And clearly the importance of those research priorities at the outset. Josie, can I ask from Wellcome's point of view, how you dealt with aligning to global or local research agendas?
No, absolutely. So I think one of the biggest challenges at the beginning of any outbreak, epidemic, and COVID pandemic is information and gathering that information, understanding who wants to fund in this space. We all have different remits of areas that we want to focus on. So who do we want to partner with if we want to be complementary? And this is exactly what happened. We were lucky that we were building on some great experiences. We were already working with SCDO through the joint initiative that we funded over several years. We had already strong established connections through other funders, both within GloPID-R, UKCDR, but beyond that. So a lot of the January, February month was really finding out who's doing what are we going to do, and working with WHO to be able to pull together that research agenda meeting and convene. And we all knew that was just the beginning. You can see at that time a lot of us launched our funding, which was trying to be targeted. We wanted to be able to support a research agenda and be targeted to where we would act, and that's why SCDO and Wellcome for our COVID rapid funding was on low middle income countries. And it continued throughout the pandemic to really understand, okay, so we're going to do this, Wellcome's going to focus on the therapeutics accelerator on this particular area, but who's filling those other gaps? I think this is something we can continue to improve upon. I think the scale of COVID really took a lot of us by surprise. We had been working in the outbreaks epidemic space, not preparing enough for a pandemic. So this is where the improvements will really go. And ultimately, we need to be clear, what does each funder want to invest in? What's our remit? What's our space? Who's doing the broader health research agenda? Who's doing the non-health and health together? And clearly communicate that to the research community so it's easier for them to come to the right place to get funding.
Thanks, Josie. That's really helpful and really important in terms of clear communication and collaboration during this whole process. The number of meetings that there's been in order to attempt to result in a cohesive research response, despite the limitations in that have been highlighted in the report. Now, to move on, clearly the next theme that we would like to discuss with this panel is around thinking about evaluation of the research response and next time. And we've started to touch on that already. Just really want to clearly make the point also at this stage that clearly the research response to COVID-19 is by no means over. There's been great progress here, but what this report is meant to do is look at the first year of that research response and reflect. So the lessons learnt from this report and the work we've been doing, we hope will improve and influence the ongoing research funding and research response to COVID-19 and also to potential future epidemics and pandemics. So just to make that point really clearly before we move into this idea of evaluation in the next time, that we're still in the midst of this. Joe, I wanted to go across to you to pose the rather tricky question of how do we evaluate success in terms of the research response to COVID to date?
Yeah, you've given me a really hard question here. I mean, it is the $1 million question, and it is the most important question because I think, and I suppose the question of, how do we evaluate is, it needs to start with what is the change that we're expecting to see. We're not funding research in this area in pandemics, in low middle income country, relevance for sort of low middle income countries, just to increase the footprint of research, although in some respects that does matter, but we're funding research because we want that research to make an impact. So while, the perspective I come from a development agency perspective, which is not just, how much research is being funded, but who is benefiting from that research. And for that, I think you really need to take an end-to-end perspective and make sure that, with FCDO, we make sure that we're investing in mechanisms to ensure the pull-through of research into changes into policy and practice on the ground, and eventually, impacting on people's lives, saving lives, I think is the holy grail. So, that's why FCDO has been a leader supporter of the COVAX facility for vaccines, and that support to COVAX is going to be critical to supplying COVID-19 vaccines to poorer countries, albeit from a very slow start. Ultimately, I guess, in FCDO, we all measure success by the numbers of people benefiting. So that could be numbers of lives saved or numbers of lives that are, cases averted. But obviously that's going to be hard to model in a pandemic situation. To kind of get to those, those outcome indicators is always going to be difficult. So you're going to need intermediate indicators. So things that we're going to be interested in terms of evaluating success are looking at the balance of research projects that are approved and checking whether there's a good balance across the research development pipeline in terms of the sectors, but also in terms of the stage of research. Is it early stage research or is it late stage implementation operational research? We're going to be looking at qualitative evidence, looking at how programs are engaging or influencing national or international expert panels. How are the researchers that we're funding, how are they engaging with the discourse in the countries that they're working? What is the, is there any evidence that they are influencing decisions, contributing to that kind of flourishing scientific environment that we know is important to kind of encourage uptake of evidence or knowledge on effective interventions. So that's the kind of those are the kinds of things that we are interested in. Obviously, you need when you're thinking about evaluation and you're looking at impact, you really need to be thinking about what are the underpinning assumptions that will be linking those research activities to the research outputs and then on to impact. And here you can talk about theories of change, or we use logical frameworks. All of that's important actually. And the sooner that you get those indicators pinned down at the beginning, ideally before the response, and then you can be tracking them throughout the response, and then you've got some sort of framework upon which you might want to be able to hang an evaluation. The worst position you want to be in is at the end of a response to kind of look back and say, right, how do we do? Because if you're not collecting some of that data in the meantime, it's really difficult to do that post hoc. So those are the kind of things that we are interested in FCDO when we're thinking about evaluating success.
Thanks, Jo. A very comprehensive answer, and I think this is, the direction of thinking that a lot of funders will be moving towards now, and possibly, another fruitful area for discussion beyond this. Clearly, the report itself is more looking at the process of funding, and more looking at how that was enabled against principles, but taking it that one step further to a kind of fuller impact evaluation of research response. Will be on many funders' minds. Jean-Marie, just to turn to you for a short response on your thinking about how feedback loops, how one can be thinking about this as a funder continually throughout the funding response.
Yeah, thanks. I think some of the lessons that are based on the 7 principles in the report, they are relevant in terms of the funders thinking on how to address future response to pandemics or epidemics. Some of them, I was mainly thinking about how we can enforce some of the things which are nicely worded in the call text and in the grant agreements. I'm talking about things like open science and data sharing. There are a lot of nice wishes around those kind of things, but in practice, I see that as a challenge. So if we can maybe keep rethink about how we follow up some of these things, not only providing funding for to support such a cost, but also to make sure as a funder we have a way of following up some of those commitments early on from the moment that a project is releasing the first outputs. How are they being shared? Some of those things will have to be rethought through. But it's also I was also thinking about the some of the maybe in the questions, but maybe the report does not cover that part, but separate reports in their publications reveal, at least if you look at LMICs, that women and infants are somehow neglected in research. Maybe the proposals that were coming to quick calls were easy to write if you look at the traditional populations targeted by research. But if you look across many of the funders that initiated the early calls, not a lot of projects did not pick up actually pregnancy issues. You realize that later we were maybe trying to list projects that focus on the key populations, but some of these elements, which also if you look at HIV experience, for example, maybe funders or researchers took up those questions much later in the process. So also for pandemics, it would be good to have, whether it is under equity or inclusiveness or ethical considerations, the key populations, elderly people, some of those, if you've been doing or funding research in LMICs, you have to be very explicit about these groups in research. So this is an area which I thought it's worth highlighting. But also, we've been talking very much about national and regional research agendas. So Josie mentioned the issue of Ebola in Congo, but if you look at maybe 6-7 years later after the pandemic, the epidemic in West Africa, Ebola again, there were a lot of capacity built there, which is being used to respond to COVID. But some of those things maybe are obvious to individual funders who supported that work. But if we as a community, as a family of funders within GloPID-R can help each other in terms of capitalizing on whatever was built, responding to earlier crisis, that is something which actually can maybe help us in terms of maximizing the use of the small resources we have. So it is an issue of collaboration across funders, maybe because we know a lot individually as individual funders, but if we can keep collaborating also at the time of initiating calls or maybe drafting research agendas, it will help us maybe save a lot of resources and respond efficiently to epidemics.
Thank you, Jean-Marie, very much. I think we've sadly lost Charles just as I was going to give him a final question, but I'm back. Oh, you're back. Well done, Charles. We've been integrating some of the questions from the audience as we go, but Charles, I just wanted to direct one to you now, which is coming, which I think is really relevant to this current discussion, which we need to wrap up quickly. So, succinctly, Charles, what do you think in terms of any negative impacts of the focus on COVID research, in terms of research lost to other areas, and are there any kind of lessons that could be learned from that?
Yeah, I think unfortunately we only have finite resources, whether it's human or financial resources, and if the more concentration we had on COVID, it was inevitable that we are going to maybe lose focus in various areas. But I think that we only need to have a plan really and learn from the lessons learned from this pandemic and see how to be better prepared, to be more holistic in responding to both any pandemic and then, of course, existing challenges. And in the low and middle income countries, Africa, for example, we know very much how while COVID was going on, HIV was still there, malaria was still there, and I think that we need to learn how to be equitably distribute the resources and not have just very strong vertical programs, while other areas also important are failing.
Thank you, Charles. I think that's a really, really salient point to finish this discussion on and to bring it all into context. So I just want to end this part of the meeting by really thanking wholeheartedly our panelists, Josie, Jean-Marie, Joe, and Charles, for your really honest and frank discussions here on these topics, and look forward to continuing these discussions with you. So thank you for your time. And thank you to the audience members for really, really helpful clarification and pointed questions there, which I hope we've started to address. Now it's time to pass over to our team of research assistants, who've not only been working really tirelessly on the COVID-19 funding tracker in terms of sourcing, coding and mapping all the 13,000 projects within it. They've also been really integral to this learning exercise. So we're now going to hand over to them to present a selection of recommendations for the case studies. And just to outline, these case studies are aimed to demonstrate best practice and innovation in relation to any or all of the COVID Circle 7 principles. So Emilia, please go ahead. Thank you.
Hi, good afternoon, everyone. So my name is Emilia. I will be presenting on 3 funding calls, which demonstrate innovative funder practice. And in these case studies, the funders have demonstrated their adaptability and flexibility to the evolving research needs in a pandemic. And they've also incorporated some of the lessons learned from funding in other disease outbreaks and health emergencies. So as has already been said a lot in the panel discussion, the case studies show the benefits of investing in long-standing capacity and partnerships. So I'll be beginning with the EDCTP COVID response. And this response leveraged contingency funding that had been drafted into the 2020 work plan. And so it could rapidly be mobilized at the onset of the pandemic. EDCTP had also made some prior investments into capacity and preparedness, such as in the Pandora IDNet and the alert initiatives. And all these facilitated a very rapid response. So one of the key recommendations from this case study is the need to make very strategic partnerships and invest in preparedness initiatives. Next slide, please. So for the GECO call, it was geared at addressing research knowledge gaps in low and middle income countries. And interestingly, the 7 funder principles for funding high quality research were developed as part of the GECO call, drawing on inspiration from the EDCTP call specifications. And the GECO funders had applied an established funding model for funding domestic UK research, and this approach improved the efficiency of the funding process. So one of the key recommendations that came out of the GECO funding call was the need to establish these response mechanisms in advance of future outbreaks to enable there to be prompt responses. Next slide, please. And finally, for the R2HC response, this rapid response was triggered to generate evidence on the pandemic in humanitarian settings. And this one is remarkable in that it shortened the research funding process from about 12 months for funding in normal times to, on the average, 14 weeks in the rapid response. And several different approaches were taken to achieve this, including expediting contracting and due diligence processes, as well as shortening the proposal review and submission process. And the response drew on lessons that were learned from funding the Ebola crisis and other acute health emergencies. And so one of the recommendations here is to learn from this current pandemic response for the future. So Nusrat and Margaret will be presenting on the project level case studies. Thank you.
Thank you, Emilia. Hi, this is Nusrat, and I'm going to talk about the COVID-19 Child Abuse Prevention Emergency Response Program. First, I'll give a brief background, and then I'll talk about the lessons learned from this program, and finally, the recommendations. In response to COVID-19 pandemic, the COVID-19 Child Abuse Prevention Program developed a set of evidence-based open source resources to reduce parent stress and prevent child abuse during the pandemic. And also it targeted that the program impact exists even beyond the pandemic. So For rapid implementation, the project built on the existing research capacity and system, which was established by the Parenting for Lifelong Health program from 2012. The project also utilized multi-sectoral partnership where co-creation and shared ownership of the program content was a priority. So far, the COVID-19 parenting program reached to over 196 million people from 198 countries. So what are the lessons that we learned from this successful program? First of all, the innovative and open resource dissemination method of this program were based on understanding the cultural context and local priority, where public and community engagement was an integral part of this program, which ensured acceptance and large-scale impact of the research content within a short period of time. The program also demonstrated that the long-term funding of parenting program enabled capacity building for the COVID-19 child abuse prevention program, which was then built by the rapid funding to facilitate a faster and effective response during the pandemic. The greater collaboration and coordination from long-term partnership is another key lessons that we learned from this project. This project has collaborated with over 600 implementing partners. The relationships and trust that were built through this partnership contributed extensively to accelerate the success of the program. As the key recommendations, I would like to highlight that the funders need to be aware of the joint effect of the long-term funding and rapid funding for emergency response. And we see that throughout the webinar, we were discussing the importance of pre-existing research capacity. That is a contribution of long-term funding. And finally, multi-sectoral and interdisciplinary partnership across global, national, and local levels are recommended for when we are trying to tackle any epidemic or pandemic at the crisis, during the crisis. So this was, and we also learned this lesson from another case study that we did on Africa CDC response to COVID-19. That's all from my side, and now I am going to hand over to my colleague Marguerite for the next case study presentation. Thank you, everyone.
Hi, everyone. My name is Marguerite. I'll be talking today about ICODA, and it's an initiative for data sharing, data access, and analysis, which for us was a really innovative example of the funding principles in practice. ICODA's creation was really catalyzed because of the pandemic, but the issues that it addresses are longstanding in research. And there's really two big ones. The first one being the requirements of researchers for handling and storage of data, in particular biomedical data. And secondly, data sets that we're trying to bring together to amalgamate for analysis that are incompatible. And this was an issue that was actually brought up in another case study, the AfriMapR building blocks for the operational COVID-19 response, which you can read about more in the learning report. ICODA's approaching the problem a bit differently. They're not a data repository, they're not holding data sets, but they're acting as a bridge between data partners and researchers via an online platform called the Workbench. And through this Workbench, data partners and researchers can securely share and access data. And that removes the requirement for researchers to hold that data while they're analyzing it. It also really increases the potential for global collaboration, which has really been demonstrated by the driver projects for ICODA, which brought together researchers and data sets from around the world. And also through the Grand Challenge projects funded through the Bill and Melinda Gates Foundation. There are 10 of those so far for ICODA, and 7 of them have a majority of team members from low and middle income countries. So it's really showing that it can enable a lot of collaboration, but large-scale impacts weren't really expected during the first year of the project because it's such a large initiative. But a long-term aim of ICODA is to build capacity and trust in the platform in non-crisis times, so that in future crises, it can be used to rapidly scale up research. And these goals are really facilitated by the strong partnerships between funders that were needed to establish the platform and continue its sustainability. Also, for all the projects, the insights, the methods of analysis, instructions on how to request and access data sets and use them, all that will be left behind on the workbench for future researchers. And this also ensures that the data sets can be rapidly reused and repurposed based on emerging needs and future emergencies. So with that, I will pass it back to Alice.
Thank you very much to all of those three presenters, Emilia, Nusrat and Marguerite, for those really clear presentations on the highlights of the case studies that you can find online. Having heard about those case studies, we'd like to now open the floor at this point for any questions relating to them. If we have any researchers or funders who are involved in the case studies, I actually know we do, who are on the line, and then you would like to answer the questions that come in, please do raise your hand and then we'll be able to come to you. So we'll keep an eye on the chat to see if any questions come in, but not seeing any yet at the moment. What I'd really like to do is take the opportunity to pass over to one of the researchers involved in these case studies, which is Lucy Kluver. To hear from you, Lucy, if you wouldn't mind, just a bit more about your reflections on the work that you did in relation to the case study that Nusrat's just presented, and what was the biggest challenge that you faced in terms of your research on child abuse during COVID-19. So Lucy, if you were to raise your hand, then I believe you can be given access to speak.
Hi there. Yeah, what was the biggest challenge? I think there were a number of really key challenges, and some things we thought would be challenges, but which were incredibly easy. So what wasn't a challenge was reaching hundreds of millions of people, because there was so much demand and so much enthusiasm, and the open source approach, which in a sense we were quite scared about doing, was an enormous success when it hasn't really been done in this field. Some huge challenges involved us having our own children at home during the time. So I did end up, sticking my kids in front of Sesame Street so I could take UNICEF and WHO calls, which I was never sure whether that was a good compromise. But I think another real challenge was coordinating 10 different UN agencies and governments to agree on the exact wording and all the visuals and everything we did that within a 10-day period. And we literally stayed awake all night. We had teams of us just working all night, getting responses, adapting, sending them out again. That was a real experience. I think that the last challenge I would say is that we kept running out of money. So we started on existing funding. We had projects and we just diverted everything to this emergency response. And then we kept getting to the situation where we knew we had a month left. And someone would pop up and give us $100,000, and we'd sign everyone new contracts for 2 months. It was a scramble at times.
Thank you, Lucy, and thank you for those really honest reflections, which I think are really useful, and really useful to especially hear about the funding issues when we're looking at lessons learned for funders here.
And can we have one momentary plea?
Go ahead.
We asked if we could use funding to pay for childcare for the researchers who are leading this project, and we were told that wasn't possible in UKRI rules. Had we travelled, we could have used the money, but when we were at home and our kids were at home, we couldn't. So that was just a plea that if it was possible to change that small rule, that would have really helped a lot of our team.
Okay, thank you, Lucy. That's really helpful to hear, and thank you for the honest reflections about the complications about running, rapid research with all the contextual issues of childcare and a global pandemic hitting. That's really helpful. I don't know if any of the funders want to respond to that, but for now, Lucy, we will move on to Simon Pickard. You're available to give us some more reflections from your perspective, having led on the R2HC initiative, the case study for which was presented by Emilia. We'd really like to hear from you. Clearly, the R2HC mechanism was set up before COVID, and how have you found the use of it in responding to COVID different to other emergencies that you've used it for? I don't know if the team behind the scenes, I understand Simon's on the line. Simon, if you were to raise your hand, then we would be able to connect to you and hear from you. Whilst we are waiting for that, maybe the team can update me in the chat as to whether that is going on. Another of the funders of one of those case studies is also on the line, which is Jean-Marie. Simon, I can see you've been now put in as a presenter, so maybe if we give you a moment's pause, are you now able to turn on your camera and your microphone and give us your response? Thank you.
Thanks. Sorry, Alice. Yeah, no, you're right. The R2HC has an existing mechanism for funding research that we run through our annual calls, which we give sort of 9 months, 12 months from the development of proposals right through to the contracting and getting going. And then this rapid mechanism that we have to try and do that in just a couple of months. I think one of the things with COVID compared to where we've done this previously in, for example, the Ebola outbreak in DRC, is that the ongoing nature of the COVID pandemic has extended the timeline for studies to be relevant and to have sort of real-time impact. I mean, my overall reflection is that many of our studies that we funded were somewhat over-ambitious in terms of what they sought to do, particularly in terms of timeline. We were hoping to get sort of research findings impacting stakeholders within a 6-month period. And in reality, I think we've learned that to achieve that, you really would need to work with study teams that are already on the ground with just a small amendment to an IRB process, approval, sorry, and sort of a quick pivot. Whereas often our studies were trying to set up something new, including some form of innovation and then analysis on it. And that's taken more like 12 to 18 months. And so I think if we did it again, we'd have to look at the sort of the feasibility of what applicants were proposing, alongside making some form of judgment about how long the epidemic is likely to last for. And I think that's really challenging because I'm not sure how predictable it would have been that COVID would have this multi-phase process that would make the research findings still relevant. So in one sense, that's a blessing that there's still opportunity for these lengthier studies to impact on the research the stakeholders of their research findings.
Thank you, Simon. Yes, that's really helpful. In terms of thinking of those timelines and what rapid funding means and what rapid results might mean in terms of having impact on the current epidemic or pandemic. Or one other thing that has come out of previous work in this area and is to some extent pointed to in the report is the importance of undertaking research during an epidemic, even if it is to influence the next outbreak of that same disease. So not forgetting that, but clearly, as you say, and it was alluded to in the panel discussion earlier, the fact that the COVID pandemic has been a pandemic and therefore worldwide and long lasting is certainly a different set of circumstances from the lessons learned from previous regional outbreaks. At this stage, we are not getting any more specific questions in the chat. So what I would like, yes, we do, is having had a really good discussion around this and heard from the case studies and heard about the report, is now really encourage you all to read the report and thank you. And I would at this stage therefore like to pass over to Charu Kaushik, who is the chair of GloPID-R, who are partners with UKCDR in this initiative, to make closing remarks for this meeting. Over to you, Chero. Thank you.
Thanks very much, Alice, and good morning, good afternoon, good evening, wherever you're joining from. As Alice said, my name is Charu Kaushik. I'm the current GloPID-R chair, along with all the other co-chairs, and we are a consortium of 32 funders at this point and 4 observers, including WHO, CEPI, EDCTP, and Essence, who work closely together to have discussions about what could the funders do to work together closely in the context of a pandemic and outbreaks. Very good discussions today. I'd like to start out by thanking the panelists who brought up some really interesting insights, not surprisingly, from their own experiences, and as all of us are going through and reflecting on the past 22 months. Also, a great thanks to the COVID Circle team, and especially the research analysts who presented the case studies. These are people who are working on the ground and really providing this learning for us as funders. And I think the COVID Circle as an exercise has been really, really useful to be able to understand from funders' perspective what did we do well and where is our learnings. So the COVID Circle is probably the first one of these reports where we are starting to look at these learnings, and we all know that with climate change and other issues, the outbreaks and epidemics are not going anywhere. Hopefully, another pandemic won't come up on us in the near future. But infectious disease knows no boundaries. We know that, and we've all experienced that. And by no means are we really out of the woods yet in the current pandemic. The hope is that we will be able to make our way out in the next year or so. So some of the learnings that were discussed today, and I encourage everybody to read the report carefully. It's clear that some of the things that we did early on, and a special thanks to UKCDR for their partnership on putting this funding tracker together, because I think that was very helpful for funders to align themselves and find the gaps. And as Marie Staunton referred to at the beginning, things that we kind of picked up in the middle and realized that there was not a lot of work going on in COVID, recognizing the research gap and capacity gap in low and middle income countries. In the middle of this, and we organized a meeting and discussed sort of their priorities. And what you see in the report is some of those, what we heard and the lessons from that. And I'm really encouraged by the community of funders, as well as the collaboration with the researchers in terms of stepping up to put these lessons into action. So there are already things that we are doing that align very well with this report. Many of you may have read, or if you haven't, I would encourage you to read GloPID-R's co-chairs recommendations, which have a big focus on low middle income countries, because as we've heard frequently through this last almost 2 years, that nobody is safe until everyone is safe. So a focus on low middle income countries in terms of building capacity, research agendas, but also in terms of recognizing regional priorities. Is a big aspect of what funders are determined to focus on. Also, mechanisms for coordination. We heard that a lot. That theme has emerged many times, that relationships built during peace times are the ones that can be quickly activated during emergencies. So we were discussing as GloPID-R funders, what would that look like in pandemic preparedness research space before. And again, that's a priority for us in terms of how can we build those relationships so that they can be activated next time there's an outbreak or epidemic. I think Josie said that in her remarks that we were preparing and working hard on outbreaks and epidemics, but definitely not at the scale of this pandemic that has really sort of swept the world and everyone by surprise. So a lot of these things are ongoing. A focus on LMICs, need to build coordination mechanisms, and then of course learning through these discussions about what else can we do to focus and make things better and make us better prepared for the next is something that we are all looking forward to focusing our efforts on. In the meantime, I encourage you to read this report, and I want to thank again UKCDR for their partnership and COVID Circle for all the work that they have done on this. And back to you, Alice.
Thank you very much, Shea, and thank you for those concluding remarks. And with that, we now end the meeting. So thank you everyone for participating, to all the presenters, and we look forward to continuing these discussions and continually learning together. Thank you and goodbye.